I'm welcomed today by Ruben Garrick, one of our players within the club. Thank you, Ruben, for popping in today. He's going to be my demo, my patient, and I think he's definitely better from my last demonstration being a mannequin. So definitely a big upgrade there, Rubes. Thank you. So before we start today's session, some housekeeping rules just to go through. So obviously this session is going to be no longer than 40 minutes. We will hold questions to the end. If you have time to ask questions, please pass it to our administrator and he will forward it on to me. And please put your microphone, if you haven't already, on mute. So today, unfortunately, the last session, I didn't get to go through everything I had planned. We went through a lot of prehab. A lot of requests from the last webinar was to do a bit more practical. So I think today I'll probably focus on a couple of strapping techniques. I'll probably go through a tib fib joint strapping, patellofemoral strapping, a PCL strapping. If I have time, I might go through the MCL again, and then I suppose if there is more time after, we'll go through any sort of rehabilitation questions or any other further questions regarding strapping. The products I'll be using today will be the Leukopee wrap, the 75mm. I've got the Elasto wrap, which is 50mm. I'll be using overwrap, 75mm and 50mm overwrap, and rigid tape. Regarding the products used today, if you want to grab any of the products, please go to your local pharmacy or your local sport wholesaler. Alternatively, go to elastoplast.com.au if you need more support or if you need to find out where to purchase these products. Okay, so we're going to maneuver and do these strapping techniques, and we'll take it from there. Let's see how we go with maneuvering this webcam. So, Rubes, I'll get you lying down in the back, please. Yep, go down, please. Oh, other way, other way. So we'll start off with tib strapping. I'll try my best to make sure I include the best footage as possible to show you the techniques used. So a lot of physios and trainers don't really get exposed too much to the tib fib strapping technique. It's actually pretty commonly used in our sport. I suppose I use it a fair bit. Obviously, the tib fib joint being tibia fibula. The strapping technique is aimed to hold that joint or support it, and I'll show you what I do for our boys here. So, a lot of times, there we go. So the fibula head, what I like to do as a basis is put some Elasto wrap as an anchor. This hasn't gone all the way around. It depends how aggressive you want to do this strapping. It depends if they've got a lax fib joint or whether they've just got an irritated joint. A lot of times I'll probably go a bit conservative and just try and tighten it, cause a bit of a crease, and strap that joint. I'll probably do about three little strips there. And that's the fibula head right there. So I'm strapping right below it. Just a little bit of an anchor behind the fib, slight compression, you're taping through. It's important not to tape too tight behind the back of the knee because you'll cause a lot of calf discomfort, and if they go to run, they'll probably struggle switching on that calf. If it's a really lax tib fib joint, you may want to cut off a piece of tape, tighten that up, and then reinforce it and really compress that joint. It's really up to the athlete how comfortable they are. Obviously, you trial it not at a game, but at a training venue. With this technique, I'd usually block it off lightly, Elasto wrap around, either standing up or lying down. Overwrap, just lightly, not compressing the calf, really light around the hip joint, really light. And then to finish off, little piece of tape, locking it up. So that's a tib fib joint. That's how I would strap it. Someone who's got a lax tib fib. Hopefully you could see everything I was doing there. Now I'm going to undo this. So we'll undo this and we'll go through the next strapping technique. I'll strap the patellofemoral joint. So, oops, we've got a bit of hair there. Better than most boys. Here. Okay. Next strapping technique, we'll go through the patellofemoral joint. So I'll just go through how I do it, or in generally. See if we can position this camera. Ribs, you're a good patient. Thank you. Let's see if we can, not going to be in the way. Might actually be the other knee. Meh, no big thing. Okay. Strapping patellofemoral joint. I suppose I might do a more complex one with a bit of fat pad unloading. So how I would strap for a game day a patellofemoral joint. I like to use a lot of adhesive spray before I place any Leuko wrap. So just spraying extensively and just making sure that this really sticks on. Difficulties I've had in the past is players obviously that have a lot of hair and players that use a lot of moisturiser. So hopefully today, in our example, Ruben isn't too moisturised. Otherwise, probably not going to stick without the adhesive spray. So regarding the patellofemoral strapping, I usually start off with a bit of a Connells and I finish off with a bit of fat pad deload. The fat pad, for anyone who is asking what is a fat pad, Hoffa pad, it's basically a cushion underneath the patella, underneath the actual patella tendon. And unfortunately, in a lot of athletes, a lot of jumpers, a lot of individuals that have patellofemoral joint issues, it can get inflamed. It's pretty painful. So I actually do find myself doing this strapping technique on a regular basis. Again, how extensive your strapping is depends on the individual. But a lot of times, my Connell type strapping, always, I suppose, my experience, 90% of the time, I'll probably strap the patella medially. I can't really think of a time that I'll be strapping the patella laterally, especially the athletes I work with. But so regarding patellofemoral joint, placing a bit of an anchor there, slightly gliding patella medially. As you know, many of you know, condylar taping, trying to cause a bit of a crease. So that's the patella. So I want to go up again, covering the patella. I may do this 2 or 3 times. For a game day where I want something a bit more extensive, a bit more stronger. Dropping the patella there. Jeez, can you see me? What I'm doing? Yeah, medial glide, really getting a crease. Dropping that across. Okay. So regarding the patella, or regarding complications I've experienced in the past, if you leave a piece of tape too far across the medial knee and you go towards the back, it can cause a bit of discomfort, but at the moment I'm not too concerned because I'll show you something that I do that may help that. So that's the patellofemoral joint with the fat pad. Inferior pole of the patella, lifting up. Inferior pole of patella, the other way. Inferior pole of patella, lifting up. I might do that. A couple of strips. In some cases, I may want to strip it up just like that. Now, I never just leave it there. What my next step is, due to the fact that you have to bend the knee during the game, I usually like to bend the knee, bend it out, stretch it up, stretch it, bend it, bend it. In some athletes, this may lift up, so you just reinforce it down. Ask them if there's any discomfort on the medial surface of the knee. And me personally, to unload the fat pad. Reinforce it there. Okay. In that position, get a piece of Leuko wrap, lock it in. All right. Now, I wish I could say that's it for this type of strapping, but in my experience, if you don't do an over wrap of some nature, it's just going to peel off as they start sweating. I've done this strapping here before, haven't I? Yeah. So there's two ways of, or there's a couple of ways of locking this down. But what I found works the best is Rubes, if you're standing up a bit, please. Maybe. What I do is, in a standing position where the muscles are active, unlike in a lying down position where as they get up and switch, they activate their muscles. It feels too tight. A lot of players, in my experience, feel more comfortable getting strapped in this position. So what I'll do is go around lightly, lower the knee joint, trying to avoid taping along the back of the knee. All right, Rubes? Yeah. Not too tight. Across. Locking off the knee. I've had, in my past experience, issues when I've tried to lock off tape behind the knee by the hangies. A lot of players complain about just a different sensation, different proprioceptive feedback, and they just don't like it. So hopefully, you'll be hoping that if that's the case, you may have to loosen up that that wrap, but also cross your fingers and hope that sticks. But what I'll probably advise of, you don't want to, even though this can get loose and can fall off, you don't want to go tight all the way around. And that's probably the type of taping that I'll do for a patellofemoral joint for a game. Make sure it's reinforced to make sure that the taping doesn't fall off. Yeah, that's probably my patellofemoral joint strapping. At least one example of it. Pretty generic version of it. So, Rubes, I'll get you to, I'll strap the other knee. So far we've gone through the tib fib joint strapping. Whoa, could have been a disaster. We've done the Patellofemoral joint, and now let's aim to get a PCL strapping. And I'll go through what I do for PCLs. PCLs are a pretty common injury in rugby league, considering the fact that we're landing on our knees a fair bit. A lot of grade 1s that go misdiagnosed, or high grade 1s. The ones that don't get missed are obviously the grade 3s, where there's a complete rupture of the PCL. We're fortunate enough that in my time, you can rehabilitate a PCL that is a grade 3 conservative. I've seen some good results for some operative PCL injuries, but I suppose the rehab process of a PCL injury is a whole conversation and maybe a bit too extensive for this evening's talk. Regarding the PCL strapping, we'll go through it with Ruben's right knee, and after that we'll check what the time is, and we'll see whether we have enough time to do any other MCL strappings, and I suppose answer any questions that any of you have. So let's go for this now. All right, Rubes, are you standing up? All right, Rubes, if it's no way. Okay, for a PCL strapping, a lot of times what we're trying to aim to do is obviously stop hyperextension. So a lot of times I begin my strapping technique with, if you heal it, if not a piece of tape, nice and relaxed. If not a piece of tape, any type of material that at least will prop their foot up to create a bit of a bend in the knee. If it's a pretty fresh PCL that I'm strapping, I'll probably ask the patient to bend the knee a bit further. You want to make sure that the patient's knee or the athlete's knee is straight and not at a facing front, not sort of rotated at all in any manner. All right, so now not every PCL is the same. I suppose for the physios out there and the trainers, it's really whoever the clinician is, as a clinician that's diagnosed the injury, whatever they've found, whether it's a PCL with a lax lateral collateral ligament, a PCL that has a lax valgus stress when they stress the knee. I think that will help any of the trainers or any of the physios that are looking after the athlete on the weekend strap. So what I'll do is, rather than a generic PCL strapping that's just to stop hyperextension, I'll probably show you how I do, probably to cater for both a bit of lateral stability and a bit of medial stability. So a lot of times, a piece of elasto wrap, go around the calf lightly. Again, not to forget, with PCLs, in my experience, I'm spraying them with adhesive spray. Shot that, please, Rubes. Rubes, thanks. Someone's been training in pre-season. Let's do that again. So I want to create a flat surface as much as possible. The reason why I don't cut a real long piece is if I'm going all the way around, it ends up being a big flap at the front, and just, to be honest, it annoys me. So I don't do that. Pick it up front. What I'm doing is putting a bit of elasto to pick her up, medially and laterally. That might be too lateral. Okay. Also, so I hate personally when I get a player or any type of individual that I've strapped and they get a rash. So what I do for the back of the knee for PCLs is sticky, non-sticky, non-sticky at the back of the knee. In the past, I used to strap without this. For a one-timer, I might just not use it, but for someone that's regularly going to be strapping their PCL for an extended period of time, especially for the rehabilitation process, I want to minimise as much tape irritation as I can. So in this position, before I start doing any of the hyperextension strapping techniques to the back of the knee, if there's a lateral bias where they've done a PCL and LCL injury, and sometimes we include a tib fib. Might do tib fib first or after. Rule of thumb: three or so pieces each way, but a lot of times I just want to cover, especially the lateral ligament. It's such a small ligament, so I don't think you need too much reinforcement unless you think there's significant posterolateral corner stuff going on. Maybe. If it was purely lateral ligament injury, I'll probably be reinforcing it behind the knee a bit more going forward. But what I find is the rest of the taping will cover that. Before I go to the back, so this is the version of getting into the medial again. A lot of times, if you have a really lax PCL and you're assessing it with your knee being straight, you can have a bit of medial laxity. In those cases, I really want to enforce the PCL. If it's a pretty fresh PCL, what type tape I would use is sometimes I use Leukopee tape. It's not as striated as the normal Leukopee tape, and it's a bit more rigid. So the Leukopee tape sometimes is something that I use for really acute medials and really acute PCLs. And what I mean by acute is when they're just coming back, if I want that extra reinforcement. They've got straighter edges, so they're actually harder to rip. Engineer. So, going 2 or 3 times side. Pieces. All right. I don't lock anything off yet. I'll lock it off at the end. So that's just if there's a medial or lateral bias. So looking at the back of the knee for a PCL. Actually, what I should add, not to complicate things, but there are stages where I have, in my experience, and I don't want to hold this back, is if they've got significant posterior translation of the tibia and they're relatively acute, as a physio, at times I've anchored off the leg. I've not gone too tight on the calf, so I'm not trying to force it, but try and cause that anterior translation of the tibia, and then taping. So basically causing anterior force on the tib, going here, past tibial tuberosity, and almost connecting to that medial taping. So if I go on the other side, you'll see. I may do 2 or 3 of those strips in the early stages of the rehab process for a PCL, but to be quite honest, over time, if they've got the appropriate strength and they're a coper, what I mean by coper, meaning someone that with a deficient PCL that doesn't require surgery and can function normally in running and is not having problems with acceleration, deceleration, I probably wouldn't do that type of strapping technique. But there are cases where if you have a deficient PCL, they flare up in the game and they want that extra reinforcement. Sometimes the athlete doesn't mind having that type of taping. But to finish off the PCL strapping, that piece. So strapping the back of the knee to prevent hyperextension is knee slightly bent. Sometimes I could bend them more than that, but a lot of times by the time they're back with me, that's enough for me. It's about 30 degrees knee flexion. Strap it across. This is going to be a great wax job for ribbon. Free wax job. Stop for hyperextension. You can strap it and lay it down. A lot of times, it'll be lifting off the skin, or tight enough to lift off the skin. PCLs, I tend to really cover it laterally, but sometimes I go the whole way. Yes, it's a lot of taping, but try and come back from a PCL, playing a game of rugby league. I don't mind doing a bit of extra reinforcement if the player can cope with it. I may do 1 or 2 extra strips if I needed to, but in that position, to lock it off, only half, not the whole way around, rigid tape wise, just locking it off. Oops. Locking it off, compressing it nice and tight. Compressing it nice and tight. For wet weather games, I hate when it rains, and I've strapped individuals in this method, and the wet weather lifts up through here, or lifts up this way, and the tape just gets loose along here. So if it's a wet game and I want to reinforce it, the tape, because the athlete's just come back from an injury, we'll lock it off, elast it with a Leukopee wrap. Lock it off with the Leukopee wrap, and cover it up. So while you're around, hoping you saw that. So basically what I've done is I've covered the whole knee. I prefer tan colour, but black is not too bad. Never really use white in the game. Lightly around the knee, slightly around, connect it up, have it on. There's a few creases there, but I don't mind. All right. You'll get athletes or individuals for the first time saying, "Oh, it's so tight," but we know that as they start sweating, as let's say a game of league or rugby progresses, it will loosen up to a certain degree, but having that extra little bit tighter isn't necessarily a bad thing, especially when they're coming back from a PCL injury. But the biggest thing for strapping a knee is you want to make sure that the athlete is comfortable in training. It's been trialed, it's been tested, and you don't want to be trying anything new on game day, because that's probably, in my opinion, not best practice. Alrighty, let's go for some questions. And we'll cut that tape off soon, Rubes. Oh, he's down next to me, Rubes. To be quite honest, you get used to strapping and you don't get used to explaining it that well, so hopefully that made sense. Rubes, you were great. Thank you. Yeah, hopefully that was all right. So let's answer some questions. Okay, so I've got a question for the admin. Are there any injuries discussed more common amongst certain athletes or positions? Or I suppose, example, wingers versus props. Is there a difference? I don't think, being the way the game's played now, I'm assuming like you get the same injuries all across the board because it's such a contact sport, isn't it? So I suppose forwards do, they're taught to land on their hands and knees a fair bit. I suppose wingers are too, but they're likely to maybe get a PCL maybe, I reckon. But pardon? Yeah, trying to get a quick Patellar ball, landing on their knees to get a quick Patellar ball. But I don't think. I think personally, I can't really distinguish between positions. Sports, rugby league, in particular PCLs, MCLs, contact type injuries, they're obviously more prevalent than I suppose another sport like football, where you may, like soccer that is, that you get maybe more non-contact type knee injuries. Yeah, I don't think there's a big difference. Next question. Okay. Do you see more of these types of knee injuries, or are MCL plus ACL more common? I think that's sort of what we discussed, that I suppose MCL, in my experience, is more a contact-based injury. A lot of times in rugby league, you're getting someone being held up and then someone goes for your knees and you get an MCL type injury. But ACL, I suppose, is pretty you get it in any sport, I suppose. It's just a non-contact injury. It's more to do with the individual's capacity and whether they've got the right mechanics, or it might be an incorrect surface. So many other factors that affect that ACL. I don't think a sport other than I suppose the bigger determinant isn't the different type of sport, it's probably the intensity of play. The higher the intensity of play, the more likely you might be predisposed to get an ACL injury, or if you're not conditioned for that type of intensity or that type of gameplay, and you haven't done, let's say, the stepping, cutting type action for a while, you may be predisposed to that type of injury. What is the average PCL rehab length? It depends on the grading of PCL. I suppose a lot of times grade 1, you probably wouldn't miss many games. A grade 2 that has a bit of laxity, but it's still a solid infield. It could be anywhere between 2 to 4 weeks. I suppose depending on the type of season, what time of the season that injury is. If you had a grade 2 PCL and it's finals time, you might not miss any time. But with a grade 2 and then we go to a grade 3 PCL is a complete rupture, you want to make sure the rehabilitation, they keep working on their strength over time. But a grade 3 PCL is a complete rupture. I've had players come back between 4 to 6 weeks. There's even individuals I know that have come back even less than that. Really depends on swelling. I think the biggest determinant of someone coming back from to play an elite level of sport, it depends on if they when they run, if they're feeling unstable, how they go with the acceleration, deceleration. But if you do have time, in a perfect world, a PCL injury, a grade 2 could be a 4 to 6 week, I'll estimate, and then a grade 3 could be upwards of 6 and plus. Depending if the patient is feeling unstable. If a patient's feeling unstable, no matter what happens, and if you can't strengthen their quads and calves and make them strong enough, they may be looking at an operative intervention. Hopefully that answered it. It can be more complicated than just, I suppose, just talking about what's the rehabilitation. I think there's uniquely, it depends on the case scenario. It depends on the athlete. It depends on the patient. It depends on the type of injury. It depends on the context of the injury. I suppose a lot of times, a lot of things I'm discussing is relevant to my environment that I work with, but we're usually pushing the barrier. And yeah, I think a grade 2 missing 2 weeks is can be a conservative at times, and grade 3s could be back in 4 weeks. Oh, there's a few more questions. Unfortunately, we're nearing the end. We'll try and get to those questions maybe through email. I hope everyone got something out of this session. Hopefully it was worthwhile, insightful, and useful. Thank you for joining me tonight. Thank you, Ruben, for joining us. I'm surprised no questions are asked for Ruben. But I'll finish off in saying that if you need any more information from Elastoplast or regarding any content regarding today's session, please go to elastoplast.com.au and you can even visit their Facebook, Instagram, or LinkedIn. Again, please feel free to email the admin team, and if I can help in any way in answering questions, I hope I can. And yeah, thank you for joining us.